Natural and artificial methods of contraceptives. They can lessen the pain of menstrual cramps, keep acne under control, and protect against certain cancers. As with all medications, they do have some potential risks and side effects. The disadvantages. Adverse effects include nausea, breast tenderness, breakthrough bleeding, amenorrhea, and headaches. Oral contraceptives do not provide protection from STDs. Daily administration is necessary, and inconsistent use may. Oral contraceptives. The combined oral contraceptive pill is often just called the pill. It contains artificial versions of female hormones, estrogen and progesterone, which are produced naturally in the ovaries. If sperm reaches an egg, ovum, pregnancy can happen. Transdermal patches adhere to the skin as a way to deliver drugs. They provide a specific, predetermined dose of medication that is absorbed through the skin and into the bloodstream. Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended periods of time. The ring is inserted into the vagina and provides contraception protection. Vaginal rings come in one size that fits most women. Subdermal contraceptive implants involve the delivery of a steroid progestin from polymer capsules or rod placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The contraceptive injection prevents pregnancy by injecting a synthetic version of the hormone progestogen, called dipot medroxyprogesterone acetate, or DMPA. The injection is also called depo. Depo prevents the body from producing its own hormones and releasing eggs from the intrauterine device, also known as intrauterine contraceptive device or coil, is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control. Chemical barriers destroy pathogens on the outer body surface, at body openings, and on inner body linings. Sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. Urine is too acidic for many pathogens, and semen contains zinc, which most pathogens cannot tolerate. Diaphragm is a barrier method of birth control. It is moderately effective with a 1-year failure rate of around 12% with typical use. It is placed over the cervix with spermicide before sex and left in place for at least 6 hours after sex. Fitting by a healthcare provider. Cervical cup. The cervical cup is known of barrier contraception. A cervical cup fits over the cervix and blocks sperm from entering the uterus through the external orifice of the uterus called the os. Condom is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection. There are both male and female condoms. Female condoms are barrier of contraception worn inside the vagina. They prevent pregnancy by stopping sperm melting an egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put in. Female surgical sterilization is a form of permanent contraception that involves sealing off or blocking a woman's fallopian tubes. It is also referred to as tubal ligation or having your tubes tied. Natural methods. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen. Calendar-based methods are various methods of estimating a woman's likelihood of fertility. Based on a record of the length of previous menstrual cycles, various methods are known as the nose, Ogino method, and the rhythm method. The basal body temperature method. A fertility awareness-based method is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. Fertility awareness refers to a set of practices used to determine the fertile and infertile phases of a woman's menstrual cycle. Fertility awareness methods may be used to avoid pregnancy, to achieve pregnancy, or as a way to monitor gynecologic. And lastly, the sympothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation.